It's known as Trank on the streets. Xylazine is a veterinary tranquilizer used to sedate large animals like cows, but is now being found in illicit drugs like fentanyl, a powerful opioid. It's prompting states, most recently Pennsylvania, to add it to its list of controlled substances. Meanwhile, other states are also on the lookout. In Florida, FamiliesRecover.org founder John Nelson, a group that helps loved ones deal with addiction, plans to ramp up his group's awareness of Trank.
You know, when you got somebody that's in the trade that's making like Molly, or they're taking fentanyl and cutting it with Trank, it's all about the profit margin.
The drug is also alarming to medical professionals since much is still unknown about xylazine and how it affects humans. Jean-Marie Perrone, an emergency physician and the director of the Center for Addiction Medicine and Policy at the University of Pennsylvania, says local drug testing shows xylazine almost always co-occurs with fentanyl.
Some people's theory about why xylazine is being added is because the fentanyl is so potent and relatively short-acting that it was added to make it a little bit more longer lasting and to not have the potential deadly respiratory depressant effects that fentanyl is essentially known for.
According to the U.S. Drug Enforcement Administration, about 23% of fentanyl powder and 7% of fentanyl pills seized by the DEA contained xylazine in 2022. Earlier this month, the White House Office of National Drug Control Policy declared fentanyl combined with xylazine as an emerging drug threat in the U.S. During a news conference late last month, Senator Chuck Schumer warned xylazine is deadly and dangerous.
And it causes severe wounds to the skin, sometimes all the way to the bone. It creates a lot of dead tissue. There are breathing and heart rate issues, and the infections from these wounds can often lead to people even losing their limbs.
Perrone says the wounds are different from what she's ever seen.
We are not absolutely sure that xylazine is associated with these wounds, but I think we are pretty sure that xylazine has increased and changed the landscape of what these wounds look like. We're seeing these very large open wounds, which are not like abscesses or superficial skin infections. These are much deeper wounds that tend to be open and tend to progress in a way that is with a term that we call necrosis, which means a lot of the tissue actually disappears.
These wounds lead to more issues post heavy use or overdose.
Because of these wounds, paradoxically, many patients can't get into rehabs because rehabs aren't really equipped for the medical complications of wound care.
In November, the FDA warned healthcare professionals routine toxicology screens do not detect xylazine, making it harder to treat people that come in.
We don't have widespread testing. If somebody shows up in the emergency department, we can test for opioids, but we don't have widely available tests for xylazine.
To reverse an opioid overdose, the FDA says naloxone, also known as Narcan, should be used on everyone who overdoses, even though it doesn't work on xylazine since it's not an opioid.
We don't want to propagate this idea that there is no antidote for xylazine. We don't really think we need an antidote for xylazine at the moment.
Stephanie Sandoval, Scripps News.